Hi guys, here I am back at you with yet another one. Eating problems is also a sign or is a mental health problem. Eating problems are not just about food, they can be about difficult things and painful feelings which you may be finding hard to face or resolve. Lots of people think that if you have an eating problem you will be over or underweight, and that being a certain weight is always associated with a specific eating problem, but this is a myth. Anyone, regardless of age, gender or weight, can be affected by getting eating disorders. The most common eating disorder diagnoses are anorexia, bulimia, binge eating disorder, and other specified feeding or eating disorders, offset in brackets. But it's now also possible to have a very difficult relationship with food and not fit the criteria for any specific diagnosis. Another one, schizophrenia. Views on schizophrenia have changed over the years. Lots of people question whether it's really a distinct condition or actually a few different conditions that overlap. But you may still be given this diagnosis if you experience symptoms such as psychosis, which is hallucinations or delusions, disorganized thinking and speech, feeling disconnected from your feelings, difficulty concentrating, wanting to avoid people, a lack of interest in things, not wanting to look after yourself. Because psychiatric experts disagree about what schizophrenia is, some people argue that this term shouldn't be used at all. Others think the name of the condition doesn't matter, which it doesn't. They're just labels after our names, that's all they are. And prefer just to focus on helping you manage your symptoms and meeting your individual needs. So that's a quick schizophrenia one. And then we go to the bipolar disorder one. Bipolar disorder, once called manic depression, mainly affects your mood. With this diagnosis, you are likely to have some times when you experience manic or hypomanic episodes, feeling high, depressive episodes, feeling low, and potentially some psychotic symptoms. Everyone has variations in their mood, but in bipolar disorder, these swings can feel very extreme and have a big impact on your life. In between, you might have stable times where you experience fewer symptoms. So, I'm like somebody's saying, being diagnosed with bipolar, I'm still the same person inside, and with the help of medication I can now manage the extreme. Well done you. So yeah, there's one more. I'll do one more for this video. Obsessive compulsive disorder, commonly known as OCD. Obsessive compulsive disorder is a type of anxiety disorder. The term is often misused in daily conversation. For example, you might see people talk about being a bit OCD if they like things to be neat and tidy, but the reality of this disorder is a lot more complex and serious. OCD has two main parts: obsessions, unwelcome thoughts, images, urges, worries or doubts that repeatedly appear in your mind, and compulsions, repetitive activities that you feel you have to do to reduce the anxiety caused by the obsession. Faisal's story. Faisal explains why he didn't feel able to talk to friends and family when he first started experiencing obsessions and compulsions, and now CBT has helped him manage. Read the transcript of the podcast here. Personality disorders. Personality disorder is a type of mental health problem where your attitudes, beliefs and behaviours cause you the long-standing problems in your life. If you have this diagnosis, it doesn't mean that you're fundamentally different from other people, but you may regularly experience difficulties with how you think about yourself and others, and find it very difficult to change these unwanted patterns. There are several different categories and types of personality disorder, but most people who are diagnosed with a particular personality disorder don't fit any single category very clearly or consistently. Also, the term personality disorder can sound very judgmental. Because of this, it is a particularly controversial diagnosis. Some psychiatrists disagree with using it, and many people who are given this label find it helpful to explain their experience in other ways. So there we go, folks, one more video down on mental health. There's a few mental disorders that I've covered this morning and this afternoon, so I'm going to leave it there, have a rest, regroup and get some more out tomorrow. In the meantime, you look after yourself, take care, please like and subscribe if you like the video for more content to come. Take care and goodbye, God bless.